Ghana's public health system had been lacking many things, including emergency medical services.
We had a national ambulance service that was pretty much broken.
This was worrying.
You get up, go to the office just to turn away calls, because clients will definitely call you. We need an ambulance, and all you are sitting down doing is, we don't have an ambulance, we don't have an ambulance.
The impact of this was catastrophic. Many lives were lost.
Attempts to carry my chairman on the motorbike to get him to Agogo, which is the next biggest hospital. By the time they got to Agogo, the venom had traveled all the way to his heart. And so we lost him, unfortunately.
It got a point that people actually started not patronizing our services, because they'll call and they'll have to wait for 1 hour. They'll have to wait for 2 hours and probably the whole day, and they won't even get the ambulance.
Ghana certainly cannot meet the 2030 universal health coverage with this.
As we went around from place to place, every place you go, the request will come, we need an ambulance, we need an ambulance, we need an ambulance. And it was a reflection of the fact that the National Ambulance Service had really virtually collapsed. And we needed to revamp it and make sure that we are not just buying ambulances which will continue to serve just a few areas, but the idea was to buy ambulances that will serve every constituency in this country.
Pre-hospital care is very important because people either in an emergency fall sick, either at home, on the way, and before, a lot of things can happen before the person gets to the hospital, and that is extremely an important part of the care.
President Akufo-Addo's solemn promise to revamp the National Ambulance Service was honored in January 2020.
I'm really happy that finally this day has come to meet us. This is the day the Lord has made, and we should rejoice in it. This ceremony is a very good way to begin the year.
Ever since independence, we've never had 307 ambulances in the country. And this is international standard, not those kind of ambulances that we used to buy in the country. It is an international standard. So as a woman under the ministry that procured this ambulance, I thank God, and I also thank the President for giving me that opportunity, because he has a vision and he asked me to implement it.
The National Ambulance Service, led by Professor Ahmed Zakaria, had for years been waiting for a day like this.
We have every reason to be very happy, not just because it has made our work easy, also the fact that it has helped improve the quality of care when you look at the pre-hospital emergency care services.
Without these ambulances, Ghana's fight against the COVID-19 pandemic would have been disastrous.
We transported about 1,130 cases, 1,130 COVID cases. And at a point in time, I was just wondering if by any means these ambulances were not in, then this COVID situation, it would have been so disastrous.
And yes, it has been a game changer.
Going by our motto, timely care saves lives. Because when it happens, this time round, we are there on the spot because we have the resources available to us.
Now, patients who are arriving here in ambulances, all of them, there is a prior notification to our center here to inform the nurses and the doctors to be in readiness to see the patient. But some patients arrive here when beds are prepared for them, and we know sometimes the operational diagnosis, even on the ambulance or from the centers that they are coming with, so that we prepare for their management before they arrive here. And these are all translating in better outcomes.
This is one major intervention the government is extremely excited about.
I told the president on the days, Mr. President, tonight I will sleep. That is a key sort of expression, that kind of language when you have become relieved of having solved a problem. You pause and say, tonight I will sleep.
I thank God for giving Nana Akufo-Addo this vision to bring all of this on board for this country, because ultimately you cannot put money on the cost on a life, right? The life is precious, and when you save a life, you have to thank God for that happening.
The men and women in the green uniform are appreciative to the government.
I just want to say a very big thank you to the president for hearing our cry.
After months of taking delivery of the 307 state-of-the-art ambulances, we take a journey to 5 regions: Greater Accra, Eastern, Ashanti, Northern, and Upper East regions to assess their impacts. Today, we are in the eastern regional town of Esikim to meet Adelaide Oredua. Few weeks ago, this young woman nearly lost her 20-month-old son, Ezekiel Adams. Adelaide woke up together with her son one early morning. The driver thought he had run over an animal. He didn't know he had rather run over Ezekiel. A distress call from outside their house made Adelaide rush out, just to find her baby in a pool of blood, with deep gaping cut in his head and lips, with blood oozing through his nose. Adelaide immediately took her son, put him in that same car, straight to the Chibi Government Hospital.
Chibi doctor who sent a committee and then they took a pine and hair. So Pam, they took one on a man, you know, it's needed. I said the cook food was central. Now says I remember the fee, Mrs. Simon. To be a family system, Nam San call back, no some of friend ambulance. Ambulance in the banner on the map.
This was the moment the assistance of the National Ambulance Service was needed to help transport the boy to a bigger facility for advanced care. The emergency medical technicians moved with the speed of light to pick up the boy. Their swift response has been linked to the availability of ambulances in every constituency in the Eastern region, which makes it possible to meet the 1-hour golden rule.
The research has shown that, for example, the best chances of survival definitely will be getting the patient into a hospital environment, getting the patient into theater, an operation room for that matter, and be able to work on the patient within the 1 hour. Beyond the 1 hour, the chances of survival begin to diminish. So no matter how much time you spend in the pre-hospital setting, normally you don't do much help to the patient as compared to moving the patient to the hospital.
If you miss that 1 hour, if you are not very careful, the victim becomes a vegetable. If you miss it, that's the end.
The state of her son made Adelaide conclude, but for the National Ambulance Service, she would have lost him.
The drew on all non Jimmy Ban command, nurse for emergency, or more Mujina, may Akranumaka, and sound of Mutuata. I was saying, Wamish said. Taxi to me for our own sad distance in a short time, but ambulance today at least more than 1 hour 30 minutes there. Bit me and in case of this experiment, Send an ambulance, doctor being referred to also our big hospitals. Say, no, I said, I put a personal and so that doctor being over here for land. So the taxi report there. Send for ambulance, Mary. And from Tabuan, 17 ambulance, either say, every ban once one I said, then a man.
Ezekiel's story is one of the 4,080 cases the ambulance service in the Eastern region has attended to in the first 8 months of receiving their share of the One Constituency, One Ambulance.
We're having 18 ambulance stations in the region, and after we received the new ambulances, we increased our stations to 33 in the region. So what it means is that we have more territories to cover this time round. And if you also compare the cases that we receive as against the previous cases, in a month, sometimes we used to do averagely 100 to 150 thereabouts. But sometimes we do receive more than 300 calls, let's say in a month.
All ambulance stations across the country are attending to more patients now. The National Ambulance Service boss, Professor Ahmed Zakaria, says there's a reason for this.
If you look at the number of cases that already have been attended to, if you take a 5-year span from 2004 to about 2010, you will see that we attended to about 25 plus cases. Then from 2012 up to 2016, if you look at it, we attended to about 50 plus cases. But just in these 9 months, we've attended to over 19,000. Okay, almost 20,000. So if you just even make this comparison without waiting for even 4 years, you will see the number of cases that have already been attended to within this short period of time. And that is explainable. One, you now have more ambulances, you have more ambulance stations, and therefore you have more cases that you are attending to.
I've looked at some of the data from the National Ambulance Service on the calls. You will see that in fact we had a major decline over time of calls to the ambulance service, because people knew that if you call, you wouldn't get an ambulance anyway, for the most part. So if you look at the data, you will see a major decline in the calls to the National Ambulance Service for ambulances. But since 2019, when you look at the data, you see a major jump in the call. And this means that the ambulances are saving lives, because as you respond to medical emergencies, you are saving lives.
With the Eastern region being one of Ghana's accident-prone regions, the One Constituency One Ambulance has come in handy.
In an emergency or in a road traffic accident where there are injuries, the way people are managed is extremely important, how they are carried. For example, if you have a fracture, if you are not, maybe just a crack, if you are not managed properly, they can complete the fracture. If you are not managed properly, the bones can be shifted somewhere else. If you have a back injury, you have to be carried in a very special way. The way you are carried is extremely important. If that is missed, you can also cause further damage even before you reach care.
In the Ashanti region, one case that became very topical and has stayed with both paramedics and regional heads is how a pregnant woman carrying twins and in labor got saved, courtesy the National Ambulance Service. Setra From Plains District Chief Executive Joseph Jimfi Owusu first made that call to the National Ambulance Service on behalf of the distressed woman.
Eventually, ambulance was dispatched, but because of the road conditions, they cannot get into Fumsua town. So the locals had to devise a means to carry this pregnant woman on the back of a motorbike and bring her closer to the roadside. And if you walk through the video of when they were transferring her into the ambulance, It will amaze you.
And on their way, the unexpected happened, as described by Somekdud Melon, Ashanti Regional Administrative Manager of the National Ambulance Service.
This woman was pregnant with twins, and she actually delivered in the ambulance, and our emergency medical technicians were able to manage, help her and assist her to deliver the twins. So they managed her until they got to Presby Hospital. So when the story came to my notice, I was like, so imagine this patient, this particular woman was still on the motorbike. How bad would the situation have been?
Because ambulances are available in all constituencies in the country today, the team did not hassle to dispatch one to assist her.
No matter how, where the person is calling from, the number of calls you receive, you'll be able to, get to the people within the shortest possible time. And that really gives us satisfaction when it comes to our work. Because somebody is in need, and you are able to reach out to the person and to give the person the help that the person needs. In fact, it's more fulfilling than any other thing that we can offer to anybody.
At the Komfo-Anokye Teaching Hospital, a third of all admissions are brought in by the National Ambulance Service. At least 22 ambulances rushing patients to this referral facility every day. Maternal-related cases are mostly part, and the chief executive of the hospital, Dr. Hannibal Usu Danso, has observed something gratifying.
In our mid-year review conference this year, that is from January to the end of June, significantly, as against the trend for the last 3-4 years, we have recorded, for instance, a much lower maternal mortality. For the first time in such a period, and the research and the data analysis is still ongoing. But we can imagine that the ambulance service is having an impact in that domain also.
Studies suggest that pregnancy-related mortality is overwhelmingly due to delays. Health Minister Kweku Agyeman says in Ghana, lack of ambulances to help was a factor.
In the past, we were hearing people delivering in taxis. So if they are now delivering in ambulances, it's a good sign. People will wait and wait and wait until the baby is just coming before they call an ambulance, or they call an ambulance that wouldn't arrive in good time. So these things are normal things that happen in ambulances anyway. So if it's happening in an ambulance and it is not happening in the taxi now or in Uber, I think that is a good plus for the government.
Chief Executive of the National Ambulance Service, Professor Ahmed Zakaria, says helping patients and putting smiles on their faces is what they had been waiting for over the years.
Our satisfaction is really in the fact that now we have the adequate resources, we have the equipment, and we have a more motivated staff. Because every staff will be excited that you have the tools to work with. But it will have been very demoralizing if you had all the knowledge but you don't have the equipment, and before you a patient is dying and you are helpless.
What it says about the president and MPP government, that the president thinks about the health of the people.
I just want to be magnanimous, to tell Ghanaians the truth. The previous government didn't sleep about emergency preparedness. They were trying to bring ambulances. By virtue of their poor management systems, they couldn't.
The ambulance team has attended to overwhelming cases in the Ashanti region.
We have about 49 ambulances now in the region. One, it has given us the luxury to reduce our response time.
In the northern region, appreciation of the services of the emergency medical technicians are more profound. Beneficiaries recount what the repercussions would have been if every constituency there had no ambulance. Let's first start with Muhammad Al-Hassan, whose wife delivered at home while waiting for an ambulance.
I was having unrest. I couldn't sit down till the ambulance arrived. Before the ambulance arrived, by then his wife delivered. After the delivery, the wife couldn't respond and she was bleeding. So the ambulance people brought out their stretcher from the ambulance and move into the room that the wife, or they pick the wife on their stretcher and push him to the ambulance.
Mohammed recalls exactly what the team did to revive his wife before they got to the hospital.
Before the ambulance arrived, he went to the room and touched the wife, and he couldn't see any life from the wife. But when the ambulance people picked the wife into the ambulance and started giving him the pre-hospital care, he realized somewhere along the line, per their intervention, he saw the wife revive, responded to their treatment. So he appreciated the ambulance personnel, and he believed that if they were not intervened like they did, he would have lost the wife.
This young man, Abu Bakr Sadiq, who survived a recent road traffic accident, shares his experience with the ambulance service.
When we just land, the guy just crashed me and lined out. People were just surrounding there. One of them decided to call the ambulance. When they called the ambulance, less than 5 minutes, they were there. So they picked me to the hospital first, and they attended to me and dressed me and gave me some medicines to cure me. The way I was bleeding, if they were not able to attend, I think I would have collapsed then, because the blood was turning back to my head. I was bleeding through my nose and the eyes, so it was turning back. I think if it would have not come, I would have get a problem there.
Nyaba Al-Hassan Nayeli and his wife dialed the 112 emergency number, and within 15 minutes, they arrived to pick his wife, who was carrying twins, to the Tamale Teaching Hospital.
We feel good, because otherwise we should have get problem with it. So we feel good. So they have done well for us.
They all survived. In the past, they would have been part of Ghana's maternal mortality figures.
The main cause of maternal mortality is delay, and we have 3 delays. Delay in seeking health care, delay in accessing health care, and then delay in receiving health care. So my main concern is the second delay, which is delay in accessing health care. Now, delay in accessing health care after the patient has taken the decision to go to hospital, it is now the responsibility of the ambulance to transport. So now the means of transport now is the ambulance. So because of that, it helps to reduce maternal mortality drastically in the region.
All these have been possible because in the northern region, ambulance stations have increased from 7 to 18, leading to improved response time. It is therefore not surprising the call center in this region receives 5 to 20 calls on a daily basis.
You can have a district that can have 2 ambulances depending upon the number of constituencies. For example, if you take Tamale Metro, we have Tamale Central and then Tamale South. That means that they are benefiting 2 ambulances. If you go to Sanargo district, Tamale North is there, and then Sanargo constituency is also there. That means that they are benefiting 2 ambulances there. So with the introduction of these constituencies ambulances, it has come to help our response time.
Even at the CHIPS compound, at the lower level, at the local traditional birth attendants, everywhere you find a maternal case where there are challenges and the patient needs to be referred, immediately the ambulance service is called. And so obviously, if you look at even with that concept, it's going to improve the maternal mortality tremendously.
In their neighboring region, the Upper East, the revived ambulance service is responding to especially road traffic accidents involving mostly tricycles and motorbikes. Abuni Ali Baba, the Upper East Regional Administrator of the National Ambulance Service, recounts how helpless they were in times they lacked vehicles.
All you could do is, yes, if we are at the scene when it happens, then you could give basic first aid. But definitely you have to put them into a moving vehicle. That is, if the vehicle is prepared to pick, or this motor king, then let them carry the person to the hospital. That was all we did.
Now, with the 15 ambulances in the region, they are able to attend to any case from any corner of the region. In the month of October alone, they were able to attend to some 117 cases.
If you look inside this vehicle, you get to realize that if you don't deliver, then you don't qualify to wear the uniform. Because in those days, we used to turn cases away, blamed it on powers here be. Unfortunately or fortunately on our part, now the vehicles are in. And so if we are not able to deliver, then that means it is now on us and not whosoever was supposed to provide the vehicle. I remember just recently I told an anesthetist that don't be disturbed, don't feel as if what we are giving you is not the best, because we are taking you to Tamale with a case, yes. Leave whatsoever you have there, come in here and you have a moving theater to move it. So we have everything, and anybody who goes for a case and comes back smiling.
That is very true. The ambulances are indeed a moving theater.
And that's why even COVID, we're even looking at probably using some of them to resuscitate those who may need ventilation. So there are many gadgets within that helps us in helping you to resuscitate in terms of defibrillators and everything are all in that system, and that is what makes it a state-of-the-art ambulance service. Not just a vehicle, but more like a hospital, a mini hospital on wheels.
Today, we follow the EMT team to the Bolgatanga Government Hospital, where an accident victim needs to be moved to a specialized facility in Boko. The survival of an accident victim largely depends on how they are handled at the accident scene.
At the level of the neck, there is the cervical spine. So what happens is that if a patient gets an accident and the patient develops cervical spine injury, and you don't handle the patient well, the patient can go into respiratory arrest and die on the spot. And that's why some die on the spot. The other thing is, if you have the lumbar spine also being affected, the patient can be paralyzed. So that's why they always advise that when there's an accident, it's always advisable to get the professionals to handle the patient. Because sometimes patient may survive the accident, but die as a result of the handling. The other thing is extrication of the patient from the vehicle. Sometimes the patient is trapped in the vehicle. Some of the body parts might have been stuck to parts of the vehicle. And so in pulling the patient, you're likely to even damage some of the internal organs.
This is one of the packages the National Ambulance Service offers.
The care of an emergency patient is a continuum. The outcome, whether you live or you die or you get permanent disability, depends on what happens in the pre-hospital setting, and then the interventions that are made and the timely transfer to the definitive care facility. So I can say that without these ambulances, people would have suffered severe disability and sometimes death.
In the Greater Accra region, the demand for ambulance is very high. The emergency medical technicians, like their colleagues in other parts of Ghana, work 24 hours a day and 7 days in a week to meet the demands of their clients. Averagely, they attend to 30 cases a day. They drive with the speed of light to transport patients to facilities like the Greater Accra Hospital. Today, we meet 38-year-old Patience Gudu, a patient on admission here. She nearly lost her life, but for the availability of an ambulance in her constituency. Patience woke up one morning to the sight of blood while carrying a 6-month-old pregnancy. We shall be hearing from her soon. But let's first speak to the team from the National Ambulance Service who attended to her. EMT Christopher Asare led the team that day.
She had abruptio placenta. When you hear abruptio placenta, it's simply means the placenta has separated from the womb or uterus. So that one, you need urgent attention, or must be transport from that hospital to a higher hospital, either to rest the patient or to do cesarean section for the patient. So when we went there, we do our assessment and everything, and they said they are referring the case from Trobo Hospital to Ridge Hospital.
Patience was not only bleeding, she was also dealing with excruciating lower abdominal pain. In spite of this, she was still conscious and saw how she was treated in the ambulance.
They treat me like a hospital. So I like the way they treat me. They didn't put me in the ambulance like that. They treat me well, like I'm in the hospital before I came here. So when we are coming here, the car are broken away. They are talking to them that it's emergency, so we should give you a chance to come. So the way they do to me in the ambulance, I like it.
Principal Advanced Emergency Medical Technician Daniel Asare is the Greater Accra Regional Administrator of the National Ambulance Service. They feel happy when lives are saved.
We the EMTs, we work very hard 24/7 to make sure that we save lives as soon as possible. So we most of the time get such cases. We are much excited when we hear a good news that after the intervention we give to the patient in the ambulance are yielded a positive result. When we share this story during our CPD, that's continuous professional development training, it gives the EMTs morale so that it energizes them to work hard so that they can save more life as possible.
Initially, some people thought the ambulance will not be brought in the country. When we mentioned it, even at Parliament, we mentioned that there was going to be ambulances procured in the country. People said no, we could not do it because we know we have doubting Thomases in the country. And when we even started bringing the ambulance, some people said they were not even up to the number. They were not even up to 50. But lo and behold, that day we commissioned 307 ambulances. And as we speak, all the 275 constituencies have ambulance each running every day in the constituency.
Patience has a baby girl now, but for the National Ambulance Service, she thinks she might have lost her.
When I'm there, they say, I came here. They say one of a lady, they want to brought in here. They want to call the ambulance, but they don't call ambulance. They brought the car. Before they came here, the baby was dead. So I told them that it's better for them to call the ambulance. If the way ambulance people help me, if not the ambulance people, this baby will not come out. So if you need ambulance, you can call them.
We want to assure the public that anytime there's an emergency, they should call the 112. And once they call the 112, we will come and save them as soon as possible.
National Ambulance Service boss Professor Ahmed Zakaria wonders what would have happened to the country in the heat of the COVID-19 pandemic if the 307 ambulances were not in.
That's one of the success stories the country can boast of. Because if you didn't have an efficient system to contain and be able to move these cases and avoid them from mixing with the general public, our cases would have even been worse. Because you can imagine if you have attended to and contained over 3,000. Imagine all these 3,000 will have had to go into various facilities through public means. You could have just seen the ripple effect. But being able to even respond at this time, we are very happy.
It has saved the country a lot. That's why you see that even the numbers in the country that are being affected by coronavirus is not that huge for us, because as compared to other countries, we've been able to manage, and it is because of this ambulance.
Health Minister Kweku Agyeman has data to support the work the ambulances did in the heat of the COVID-19 pandemic.
The ambulances, as I speak, have carried close to over 3,000 COVID cases in our country. You know what COVID is. People wouldn't want COVID people to come into their vehicles. The initial stigmatization until now that we are getting over it. So without the ambulances, I sit back and ask myself, how could we have managed? This ambulance thing was God's intervention through our president, and some people, we, including me, have said in some occasions that The president was a blessing to this country. And when he talks about the battles of the Lord's, it's a manifestation of how the good Lord is fighting the battle for us. Not only fixing the economy, but helping us manage the pandemic the way we have done so. Right? Assessments across the globe indicate that Ghana, the way we've managed COVID, we ranked the first in Africa and third across the globe. It's phenomenal.
Vice President is not only excited about the lives being saved, but also the jobs these new fleet of ambulances have created.
The ambulances, as you will have to, each of them has a driver, each of them has 2 paramedics and so on. And all of these have had to be recruited. And therefore, definitely there is job creation in there, but you are creating the jobs to save lives.
With the coming in, there was recruitment of 1,400 plus staff because we had financial clearance to recruit the first 550. After them, we had another financial clearance to recruit 900. So if you just look at even with that, it means that you've created jobs for over 1,000 people. And that itself is a plus on its own.
The government is requesting another 4-year term from Ghanaians to revolutionize the health sector.
I'm not sure for now in the country we have any leader like His Excellency Nana Addo Dankwa Akufo-Addo, bold, decisive, and visionary.
They are working towards procuring another 100 next year, right? It may follow another 100 the following year. And that is how we may want to build on, saying that we don't go back to a situation we find ourselves in when we inherited.
We want to, of course, build upon what we have done or what we are doing. We have to protect what we are doing, build upon it, and do more. Of course, we are not where we ought to be yet. We want to see healthcare more accessible. There are many districts that don't have hospitals. We have Agenda 111, which means one district, one hospital. So there's a lot more that we want to do. We want to focus a lot on telemedicine, use technology to do telemedicine, and that is going to be a focus for us in our next term, God willing.